Christopher, thank you very much for taking up some of your valuable time, and it is particularly valuable at the moment. I know you're one of the busiest people in the country, certainly that I know of. And can you tell us where you are, Christopher, please?
Yes, I'm in Courthouse Retirement Home in Cheddar in Somerset, which is southwest England.
Right, okay. I had a good reason for ringing you, but I can't quite remember what it was. Do you want to remind us?
I think you were going to have a chat to us for the fact that myself and my staff have locked ourselves into our care home for the last 54 days.
That was it. It was unspeakable heroism. That's what
Something
it was.
like that, I
Something
think, yeah.
like that. Yeah. No, it's amazing. So, you just tell us a bit about the retirement home first of all, Christopher. It's a family-run home.
Yes, a family-run retirement home. My parents started it 34 years ago, 1986, and they always wanted to start their own business from scratch, and they converted the old courthouse in Cheddar. Wanted to create somewhere that was just as homely as possible. There was a few other places around, but they were quite clinical, quite sort of a nursing feel, where ours is just very much, we don't buy necessarily care home furniture that you expect to see. We buy furniture that fits in with a house, normal furniture for normal people.
Yeah, so, I've actually looked at your website. It does look remarkably homely. And how many residents have you got there, Christopher, just now?
We have got 23 at the moment. We are registered for 29. So we've got 26 rooms and we can have 3 couples, which would make it up to 29. But we've got 4 empty rooms, which I could have filled over time and time again in the last couple of months. But I've kept it free so that the staff would have somewhere to live with, in this situation.
So that's reduced your income somewhat, presumably, then?
It has, yes. I've worked out it's costing us about £8,000 a week. We're losing.
Wow.
For doing this, but it's worth it for keeping the residents safe. And at the moment, the company can just about afford it. There's not much leeway, but
indeed,
hopefully it'll pay off.
Indeed. So when did you first become concerned? You said you've been isolated for 54 days.
Yeah. So well, it started off. Things were obviously happening in Italy and obviously in China. So I think it's 18th of March. We closed off the home to visitors. We were sort of getting the feeling that we needed to keep things a little bit safer. So we closed off to visitors and only allowing health professionals in. Again, this wasn't guidance we were given. This is just our instinct that we went on.
This was you acting on your own initiative.
Completely.
You were looking at what was going on in the world and you thought, just a minute. Yeah. This applies to our local situation.
Yeah, absolutely. And then, I mean, that went on for, 2 or 3 weeks, I think. So it was Tuesday the 14th, just before the Easter weekend.
Yep.
I've got a friend who's a paramedic, and I was getting little bits of information from him about what was going on in the local area, because people are quite guarded, especially in care homes. If they've got a case of something like this, they're not going to want to shout it from the rooftops. People still feel as though there's some kind of stigma attached to, or they must have poor infection control methods or something like this. So, so I got a tip off from a local paramedic that there was a home which was 5-6 miles away from us that had a death and that had infections. So
once the infection was there, it spread rapidly throughout this nearby facility.
Yeah, that's it. So
and residents died, presumably.
I know one resident died, and I knew the infection was in the home, and that they, quickly tried to sort of close everything down. So I got my senior team, or certainly my other manager, I called her into the office and I just had a chat with her. It just started off as a conversation, and literally within about 10 minutes we looked at each other and we said, well, we know what we got to do. There's only one thing we can do. We looked at ways we could keep the residents safe, but there was only one thing we could do where we knew we could keep them as safe as possible. So that was it. We'd made our decision. It was just a case of making sure we had enough staff that would be able to commit to doing that.
And what did you do, Christopher? What's the strategy?
So as I said, this was before the Easter weekend. So we said, okay, although it was a really nervous weekend for me, because we made the decision that we give the family a couple of days to spend. Sorry, I'll start again.
Okay.
Give the staff a couple of days to have with their families before we did it, and this was over the Easter weekend. So although that made me quite nervous, because I was thinking, once we decided, it was dangerous out there, even those couple of days felt as though we were living on a knife edge. So so I got round to all the staff, who would be up for doing this. I mean, bearing in mind, we were talking probably for about a 2-week period, as we thought then, just to get the peak over with. Obviously, that didn't quite work out.
So basically, the plan was to pull up the drawbridge. Everyone would just live in the facility.
That's it. Yeah. Just completely. So, like I said, I kind of had a half a thought that this could happen. And so we had the empty room. So I literally spent the next couple of days looking around for mattresses, bed bases. We've got an old disused pharmacy which we bought but have never converted. So I had to get the plumber in to put the water on, make sure there's hot water and that the loos would flush and things like that. So just getting things prepared. And as you said, on the Tuesday morning, everybody came in at 8 o'clock, and that was it. Drawbridge came up, and that was us for the next.
And no one's been in or out since.
We had we started with 12 staff. After about day 3, one of our members of staff was showing some symptoms of COVID, even though we knew she had some other health issues, but we obviously had to treat it as such.
As per government guidelines, yeah.
Absolutely. So we got her tested, which, again, you're talking the very early stages of testing, which was, it was difficult. Let's just put it that way. It was on a Friday.
Yeah.
They couldn't. In the end up, they only worked up till 3 o'clock in the afternoon, and they didn't work on Sundays. It was. So she ended up. We had to wait till the Monday to get her tested, and then before we had a conclusive, you definitely haven't got it. It was almost 11, 12 days had gone by. So in this whole time, we were then having to wear full PPE with all our residents. Their visors, everything. So it was quite a stressful first week. Week and a half. Then the following week we lost another lady that couldn't cope with wearing the face masks, because she sort of had some breathing issues. And then, yes, as you said, apart from the odd doctor that has had to come in, obviously with full PPE and disinfect everything after. Nobody's been in or out.
Wow. So you've all been. So there's 10 of you for the last 54. That's what 8 weeks have just lived. Last 2 months have just been lived in the lived and worked and.
But we also had. I forgot, there was another girl. Well, actually, it was a 17-year-old girl that came in, and she'd come in just to work in the kitchen washing up. But when we lost our other 2 members of staff, things were getting a bit tight. So she agreed to go on to nights with our other night girl just to support her. And she ended up then for nearly 4 weeks, doing 6 nights a week. 17 years old. Never done any care before, and she was fantastic. But it got to the end of 5 weeks, and she needed to be with her family.
Sure.
She'd done way above and beyond what you'd expect any 17-year-old to do. So
absolutely amazing. Yeah,
she went out a complete hero in our eyes. So,
absolutely.
So so since then, for the last 3 weeks, there's been 9 of us.
So that sounds like pretty hard work then.
Oh, it is. It's at the beginning, we were finding that people, if they had a spare 5 minutes, they'd be helping somebody else do their job. And if I walked past the kitchen and there was a washing up everywhere. I got to get stuck in for 20 minutes, but that's kind of ebbed away because people have just about got enough time to do what they're doing without
their own
being
jobs. Yeah.
help anybody else.
Yeah, I mean, 9 sounds like quite a few people, but when you consider you've got 23 residents and 24 hours in a day,
Yeah,
and you need to
but
cover all that time, that becomes really quite
yeah,
significant, doesn't it?
yeah. But I mean, we've got some amazing. I mean, our chef, Gary, our chef. Now he works 12 hours a day, every day. In fact, I think he probably hasn't had a day off in about 80 days, and
That is unbelievable.
Oh, but and the food he turns out, honestly, he gives us bacon sandwiches in the morning. He does the most amazing sort of Sunday lunches. He makes everything from scratch, so nothing bought in at all. Makes all his own biscuits, makes all his own parfait, his ice creams. I mean, we're going to roll out of here, really. We're never going to walk. We're just been. So I mean that would be, if anyone wants any advice on what to do if they're going to lock in like this, get a chef in first of all, and the rest of it becomes a lot easier.
So Gary works 12 hours, has a few hours downtime, sleeps, then gets up and works another 12 hours.
Yeah, absolutely. And he's never ever said, look, I'm really tired. Can I have an afternoon off? He wouldn't even consider it. He wouldn't. I mean, he's quite a young lad, he's in his 30s, but he just likes to be on the go all the time.
Even so, the dedication is just phenomenal, isn't it? I mean,
yeah, it's incredible. And then we've got another girl, Lynn, who actually we kind of, as this was coming towards us, we were looking for perhaps volunteers in the community, or people that might be interested in doing a bit of care work in case we had to self-isolate some of our staff. We were getting quite worried about this. And a friend of a friend, Lynn, came along, and she was a chiropractor, but obviously her work had suddenly dried up. So she wanted to do some care work. So she'd actually only worked for us, I think it was for a day. And then I had to say to her, do you fancy moving in? And she's been with us ever since. She'd only worked for us for a day, So
she's been she hasn't been out the premises for the last 54 days either.
No.
Yeah.
Some quite sort of remarkable stories, really.
Indeed, yeah. We had a slight drop out there, but I think we got the gist of that. Lynn's been on the premises for the last 54 days without being a previous care worker. Now, has all this worked, Christopher? How many cases of COVID-19 have you had in the facility?
We've had none.
That is just marvelous, isn't it?
It is amazing. Yeah, it's really good.
When you consider the death rates in other facilities.
Well, we obviously the first couple of weeks we were, we weren't that relaxed because, as you know, that this thing can incubate for a period of time, and it's not necessarily going to show up straight away. So, really, for the first 2 weeks, we couldn't relax at all. I'm not saying we totally relaxed since then. We've carried on wearing the face masks, whereas people have questioned, well, do you really need to? But we've carried on because to get this far, the last thing we want to do is to be lax and kind of let it in.
Absolutely.
And spread it anyway. But
what about your own family, Christopher? How have they? It's part of the Human Rights Declaration of the United Nations that you're entitled to a family life. But you and your staff have given up your own family lives, for the sake of your residents. I mean, you've done this voluntarily. It's just, not only is it a tremendous thing that you've done, but the sacrifice that your families are making as well. Also, you can help vulnerable people.
Yeah, I mean, I've got a 22-year-old daughter at home, as I said, who's done a brilliant job of looking after our social media and Facebook and Instagram and things like that. She's absolutely amazing.
She's the right age for that kind of stuff.
Yeah, she's brilliant. Yeah, I'll just ping her photos across, and that's all I have to do is take a photo and send it, and she does all the rest. She's brilliant, and it keeps all the other families connected on what their families, the residents, are up to. How safe they are, and even actually the staff staff's families, they're able to see that their families are okay.
So she facilitates communication between the residents and their families, and you and your staff, and all your families as well. That sounds like a vital role.
Yeah, it's brilliant. I mean, it's been a lifeline, really. It's been really, really good. And then also, I've got a wife and a 4-year-old, Edith, at home, and chatting to my wife, and she has been so supportive all the way, considering she is looking after a 4-year-old, and I've had times when she's phoned up in tears, and it's a hard. It
must be so hard for you not to just dash out to go home and sort of.
That's what you feel like doing. You really do. Especially if you hear her in tears on the phone. Little ones being challenging.
Yeah, of course.
And of course, certainly for most of this time, she's not been able to get any support because her mum and dad live in Bristol and they're over 70 and not supposed to sort of come anywhere near. So literally, it was her and a 4-year-old. And it's like I've said, what we're doing in our eyes is easy because we're doing a job that we love. We're getting fed well. We've got adult company. We've got a bed to sleep in. It's great, but people like my wife, she's at home with a 4-year-old. She can only have conversations that the 4-year-old wants to have and play games with the 4-year-old, which is obviously great fun. But when it's sort of 14 hours a day, every day, it's quite challenging, I should think.
It's more than that. I mean, people all around the world now will be just amazed at your wife's sacrifice, Christopher, as well as yours. I think it's just incredible.
Thank you, John.
I'm sure you'll get many hundreds of thousands of comments that say exactly the same thing. So your 23 residents, Christopher, they're mostly elderly, presumably?
They are. They range between, I'm trying to think, our youngest must be late 80s.
Wow.
And the eldest is 106.
Wow. So these are people in the absolute highest risk category. If they got the disease, the probability of them dying is quite significant.
I mean, and we have sat down and we didn't get very far because we started thinking, well, what would happen if it came in? And we thought, yes, this lady, she wouldn't survive it. This lady wouldn't. This gentleman wouldn't. And you're sort of thinking, well, that's half of the residents would just be wiped out, And these are people that we spend more time with than our families. So they very much, I know people think it's a bit cliche when care workers say, oh, they're like my family, but they really are. You spend more time with them than you do with your own family at home. So, you build such a special bond.
It's exactly what care and health work should be: of the people, for the people, by the people. It's, you're looking after your own people in your own context. It's just, it's just exactly what it should be.
Yeah.
So, what's your plans for the next few weeks, Christopher?
Well, I've just sat down actually with my team, and we've just asked ourselves that very same question. Originally we were only going to do this for about 2 weeks. Probably as time went on, one of our local care homes was on the news about 2 weeks ago, and it's only about 5-6 miles away from here, and they've lost several residents. We don't know officially how many that is, but they've also had 30 of their staff tested positive for coronavirus, and they can't have many more than 30 staff, so that's pretty much everybody. So that was those plans out the window. There's no way we could come out into the environment outside and open up at all with that going on. And then our local hospital, you may have seen on the news, Weston-super-Mare, became the only hospital to have shut because of coronavirus, because suddenly they went from 30 to 64 cases, and a large percentage of the staff tested positive for COVID. So all of a sudden, from us thinking, okay, we're going to come out soon, to how can we come out into this environment? It's actually worse out there than when we came in. So to answer your question, John, I think the core team are planning on at least, we're taking things two weeks at a time. So we've decided we're going to get through to week 10 with all the core team here staying. And we're looking at then the safest members of staff that are in the outside world coming in to give us some support. So I think possibly during week 10 is 1 or 2 members of staff who are self-isolating well at home. We'll get them tested, make sure they're self-isolating, and then we will bring them in to do a certain amount of hours a week.
So they get tested before they came into the home.
They will get tested. Yeah, they will. So I mean, it's once we open up to the outside world, it's very, very difficult to absolutely guarantee anything. But all you can do is just try and keep those risks down to the very, very minimum.
But at the moment, you are doing your care. At the moment is guaranteeing their safety. You are an island of COVID-free. You're the UK COVID-free zone. We are.
Yeah. Yes, we are. And it's
incredible.
It's been, and even we've said, it's less stressful for us being in here. I know we're working hard, but the stresses are a lot less than they were when we were living outside and coming in daily. We don't have to worry about lots and lots of things that people in the outside world do. I mean, my brother tells me about how things are in supermarkets, about how you queue up outside to go in, how you've got to keep 2 meters apart and you can't overtake in the supermarket. We've never experienced any of that. None of that existed when we came in, so it's quite.
So all your food's delivered by supermarket vans and things, is it?
We do. Well, my brother's worked here for over 30 years, so we decided to keep him on the outside, and any supplies that we can't get delivered by the supermarket, he will get for us, drop it outside, and then I meticulously put on my PPE. I spray everything with anti-bac spray and then wipe it off. Things that I can leave outside for a couple of days, I will. But otherwise, everything's sprayed meticulously and brought inside. Yeah, so again, just keeping the risk right down to the very minimum.
Absolutely incredible, yeah. So lots of people will be fascinated in this, Christopher. Will you keep us informed and tell us what's going to happen maybe in 2-3 weeks' time?
Yes. As I said, we're only looking at about 2 weeks at a time, and that could change. Things could happen, and that could change quickly.
Yeah.
So
yeah,
the best thing you can do is have a bit of a rough plan.
Yeah.
But I think it's our staff's families, I think, that are starting to sort of think.
Of course.
I thought you were only going to do this for about 2 weeks.
Of course. Can I say, I think you're being very modest to say it's not stressful in that hard work environment, given that you've given up your normal life. I mean, when I have a hard day, I'll come home and I'll sit on the couch and I'll turn the telly on and I'll open a can of lager and, you're just in a completely different environment from work. But
yeah.
You're not. You're actually staying in that work environment 24/7 for the last 54 days.
Yeah.
It's harder than I think you are modestly giving the impression of. I think it's much more difficult than you are.
Well, I think also
you're admitting to.
We've learned to become very, very, very tolerant free with each other, because I think we know that if you had a falling out with anybody and they said, right, that's it, I'm going, then everything falls apart. Absolutely. So everything you've worked hard for will disappear. So I'm sure there's no one that annoys me in here, John, at all. But even if there were,
yeah.
But we've learned to become very tolerant, and we let things go where you may have sort of added an extra couple of words here or there, and now we just smile and say, yeah, that's fine, and just carry on with it. So you
have a common cause of protecting the vulnerable, which is really impressive and humbling. It's
yeah.
I'm sure there's a PhD for some budding social psychologist, sociologist out there, and in what you've just said in that closed environment and situation.
Well, that's funny you should mention it, actually, because there was a psychology student phoned me up a couple of days ago.
Yeah.
And she is doing a dissertation on humour and humour in extreme situations. So she was interested in having a chat. So she wanted an hour of my time sometime, just to see how, you know, we've been using humour to get by in these situations. So yeah, you're spot on there.
May well be the first of many, I would think. Now, is there any way that we can support you or help you in what you're doing, Christopher?
Absolutely can. One of our girls who couldn't move in with us because she's got vulnerable children at home decided to that we utilise our situation to raise some money for the local hospice. And we've got a local hospice to us, Western Hospice Care, who have been absolutely fantastic to us and support us when people come towards the end of their lives, which they do in care homes. They've been so supportive. So we said, well, let's give a little bit back. So I think so far we've raised about £1,600 to go to them. So I'd really be happy to send you the link.
Of course, we'd be delighted to put the link as the first thing in the description.
Yeah, I've been told it's on a just giving page, and I think if someone puts in courthouse retirement home lockdown, you will get to it. But I'll see if I can find you the link to.
Yeah, we'll put that link in if anyone who wants to do that. Yeah,
that'd be great. That'd be fantastic.
And not only that, you've given me 27 minutes of your time now, Christopher. So. And many people in the world. So thank you very much. I think we in the whole world wish you well. I've said many times on this video that civilization can be defined by how we look after its most vulnerable members. So I think you are an example of the definition of civilization, that you are giving all this up to help the people that are vulnerable. And it's many people are full of admiration, and I'm sure. And let's hope you get more recognition as you richly deserve.
Thank you very much.
Yeah, and if possible, can we talk again in a couple of weeks?
Yeah, of course we can. Yeah,
give us a bit of an update. Yeah. Okay.
No, I'm not going anywhere.
That may well be true, Christopher. Yeah. Thank you very much. Appreciate that.
All right, John.
Thank you.
Yeah, you take care.
You too. Thank you.
Bye-bye.
Bye.